The reason we're hosting this summit is to bring the intellectual firepower of two great universities to bear on what is one of the world's great grand challenges, namely how to create sustainable healthcare for the world's population.
The buzzword, if I had one, it would be sustainable innovation. So it's thinking in an entrepreneurial, creative way about how we can do things differently, because just doing things the same is not going to fix it.
So at MIT we have a theory of change about the world, and particularly a theory of change of complex systems. And we think that entrepreneurs as human agents in these complex systems are actually poised to make a difference. They can identify particular problems and really be laser focused on trying to provide solutions to those things.
In our MIT model we think about the government, large corporations, the university, but we also think about entrepreneurs and risk capital. I think they need to have a place at the table.
The universities can particularly play a role in frontline care. Within the Ebola crisis in West Africa, we played a really critical role in frontline healthcare throughout that crisis period. But I think universities probably have a greater role to play in enhancing frontline care in the development setting. In the long-term opportunities we have through global health partnerships.
It really does need to change. We really do need to turn the world upside down to think about things in different ways, to set different norms and different ways of behaving and different sort of organizational structures.
We all know in healthcare we've got to get more done with less money, less delay. There's no substitute for innovation in this space. And entrepreneurs can deliver new ideas, new ways of thinking.
And that was when I got the idea of building Clínicas del Azúcar. It's a one-stop shop to provide affordable, specialized, and convenient diabetes care in Mexico.
So what is it? It's an approach or a philosophy to derive more value from less resources for more people.
See the Science is really helping to address global challenges by looking at cancer specifically. So we help clinicians to diagnose cancer earlier using artificial intelligence.
MDAS Global is helping address global health challenges by providing high-quality diagnostics services to the people in clinically underserved communities across Africa.
So our business is addressing global health challenges as emergency response doesn't exist in more than 60% of the world. So a system like 999 that you take for granted in the UK is not a reality for most of those today.
Entrepreneurship has been neglected in the healthcare system to date. So I think entrepreneurship institutes have been really instrumental in shaping how we particularly think about the challenges and how we can actually develop them into businesses that have longevity.
I think it's essential that we let loose the entrepreneurial, innovative capacity of people engaged in healthcare so that they can think about how to do things differently.
I have seen how entrepreneurs, innovators sit at the bridge between society and change.